you've ever wondered how we fix a bunion surgically, this is a procedure that's called Minimally Invasive Bunion Surgery by Arthrex, and I'm going to walk you through that. So to do this, we'll use an x-ray unit so that we can see inside the foot so we're not making incisions. And you can see I'm prepping the unit here. It's a sterile x-ray unit. It's called fluoroscopy. And we bring this fluoroscopy unit, the mini C-arm, because it's mini. There's a larger one for some of the more involved procedures on the ankle or the knee. And we're going to use this so that we can visualize the bones inside the foot and make cuts to realign or to correct the bunion. So you can see we make a small stab incision and then we introduce a burr. And you can see this burr is going to cut through the metatarsal bone, and it's a low speed, high torque burr, so it's only going to cut bone and it won't disrupt soft tissue. Now, once we've cut through the bone, we're going to shift the metatarsal head back over and reposition it to make a more anatomical position of the great toe. So you can see there, the toe joint was out of position. We correct it without going into the joint. And the idea is that you're not disrupting the toe joint. So you'll have a faster recovery with less swelling and less pain to the joint itself. So that little device shifted the head over. Now we're putting some more wires into the foot so that we can attach a guide to put some screws in to hold that metatarsal head in place while it heals. And you can see, if you were looking at those x-rays, you can see how out of alignment it is, but we're going to form a straight bone by that cut that we made to shift the head over. Now this device that we're putting on is going to allow us to insert 2 screws, and we can start those screws in the base of the metatarsal bone, and we can orient them so that they go into the head of that metatarsal bone. And that's what that small curved guide is doing that we're putting on there. So the first piece that we put into the bone cut is a head shifter, or capital fragment shifter we call it. It gets shifted over, this curved device goes on, and it allows us to insert 2 wires. And it's designed in a manner that will place those 2 wires into the head of the metatarsal. So we're using our x-ray unit, and you're going to see here in a few seconds on how we position those wires with the help of that x-ray unit. So there are slots in that curved guide where we can put a guide that will allow those wires to pass through the metatarsal bone. Now the reason we're putting wires in is we can first align those wires up, make sure they're in perfect position, and then we'll insert 2 screws over those wires that go in to hold that metatarsal head in position. So you can see here on this x-ray, those wires are passing through the base of the metatarsal and into the head of the metatarsal, and we're going to put 2 screws over there, and that will hold them in place while the bone is healing, which generally can take up to 3 months to see complete bone healing, but the patient's able to start walking day 1 because these screws are very stable. We can get them out of a walking boot at around 3 weeks, and then we can get them walking for exercise around 4 to 6 weeks, and even running in 6 to 8 weeks. So we take that guide off, make sure on a couple different views on our x-ray unit that those wires are in perfect position, and we'll measure to see how long those screws are. This is a little device that will line up to the bone. We'll take a little reading to see how long in millimeters those screws will be. We'll advance those wires because the next step, just like carpentry, we're going to drill over those wires so that when the screws go in, it doesn't cause any cracks or stress risers in the bone. So we're advancing those wires so that when we drill, we don't pull the wire back out with the drill. We're going to put in 1 screw at a time so that it stays stable, because if you make 2 drill holes at the same time, the bones can become loose and we can sometimes sacrifice the positioning of that metatarsal head, and we don't want to do that. So we slide the screw over the wire. It goes in through the skin, that small incision you can see that we made. This is great for patients because the healing time is so much faster. It's much easier than when we made long incisions. Imagine we'd have to make an incision the entire length of that metatarsal bone to fix a bunion when we did them open. So we've got 1 screw in. We are going to take that wire out of the head just in case this other screw is coming close to it. We don't want to bump into it. You can see that x-ray is showing the placement of these 2 screws. After that second screw goes in, we'll take the wires out, and then we're going to remove that excess metatarsal bone. If you look at that x-ray, you can see the metatarsal bone in the mid part of the foot is pushed way over, and there was extra bone that we have to file away. And I'm also freeing up some of the metatarsal head to smooth it out to make it more round so that there is not any prominence for the patient. And you also may have seen some other wires. We'll make a small cut in the bone to the great toe and hold it in place with a screw. So that's our finished product. As you can see there, the metatarsal head's back into position. The screws are holding it there. And that is our before and after. You can see how much correction we were able to achieve. We'll put in a couple absorbable stitches, and this patient will walk home the same day in a walking boot. As I said, we can get them to walking a dog in about 4 to 6 weeks and running in 6 to 8 weeks. If you or someone you know have had bunion surgery and you want to tell us about their experience, drop it in the comments section below. I'd love to hear how you had your bunion repaired or fixed, or if you have any questions about bunion surgery, drop it below and I'd love to answer them.